Good afternoon and welcome to Common Hand Conditions and Care. My name is Kelsey Rosen and I am a physical therapist at HSS. In today's webinar, we're going to talk about common hand conditions, injuries, and how to treat them. Our guests today are occupational and hand therapist Daniel Crowe and orthopedic surgeon Dr. Ameya Save. Glad to have you here and thanks for joining us today.
Thank you for having us.
Yeah, thanks so much for organizing this webinar and thanks to everyone for tuning in. I'm looking forward to a great discussion.
First, we'll start off by discussing some common hand injuries. To start us off, could you please briefly describe the anatomy of the hand?
Sure, I can start with this one. So the hand is a very complex and intricate structure. It's made up of bones, joints, blood vessels, nerves, tendons, and ligaments. There's in total 27 different bones in the hand, and additionally 2 more bones, the radius and ulna, which connect the hand and wrist to the elbow. Every part of the hand is highly specialized. Even the skin covering the hand is very specialized. And all of these structures have to work together so that the hand can do what we expect it to do on a daily basis. And of course, the hand is connected to the wrist, and the wrist is connected to the forearm and to the elbow. And so even though we're sort of talking about the hand and focusing on the hand, sometimes problems in other parts of the body can also result in symptoms in the hand.
Yeah, I think that's a really good point, Dr. Sabi. I think a lot of people will come in thinking that maybe the issue may be in the hand, whether it's a numbness and tingling aspect or whatever you have, and not kind of realizing that a lot of the structures that go into the hand actually start in the elbow. The nerves feed through the whole upper extremity. So I think that's a really well-made point that I think it's good to get that understanding of that it's a kind of a collection, interconnecting part of your body that all kind of plays a role and can result in these different things.
Thank you. That's awesome. And speaking of, all of that, how would you guys say the hand is commonly injured? Most commonly injured?
Yeah, I think there's a lot of different factors. I think probably both from Dr. Save's perspective and mine in therapy, we see there's either a lot of categories in which it's repetitive stress, either through someone's daily activity or through their work-related things or hobbies and leisure stuff. We'll see a lot of trauma in the sense of falls, which are very common. We'll see a lot of, what's called a distal radial fracture, which is just a wrist fracture towards the end of the radius bone down here. I think that's a very common fracture that I'm sure Dr. Save sees commonly and we'll see in the clinic, after they've been evaluated by the doctor. So I think those are the big ones that we see, those kind of overuse, repetitive stress, and then those kind of falls, slips, and things like that.
Yeah, I totally agree. Trauma, falls, those are very common things that I see. Some of them are just sort of you trip and fall and land on your hand. Some of them can be more high energy. So those are falls from a bicycle or a motorcycle, or even sometimes car accidents can give you trauma. I do see, like Daniel said, overuse injuries, sports-related injuries. Other things that I see commonly are cuts to the hand, injuries from sharp objects like knives, glass, that kind of thing.
Great. And when would you say someone should seek care from a specialist for a hand injury?
So there's many things that, for example, your primary care physician can see, or a primary care sports medicine physician can see. Usually, if there's any concern for injury to some of the deeper structures within the hand, so that's things like nerves or tendons or ligaments, usually those kinds of scenarios end up coming to me or to Daniel.
Yeah, absolutely. I agree. And I think another thing, like, when is it time to even take that first step to see a primary care or sports medicine or a general orthopedic, and even recommend, seeing a specialist? I think because there's things that pop up sometimes we could just wake up feeling a little achy. It doesn't mean we necessarily run to the doctor. But I think when things are persistent, they're consistent, they're impacting function in particular, I think that's a good time to start getting the ball rolling, seeing a physician. Obviously, if there's any like kind of related trauma associated with these symptoms, I think obviously that's a good time to seek care. And I think we have a good sense of our body. So things like Dr. Save said, consider unusual symptoms like nerve-related things, numbness and tingling. I think that's a good one, especially when they're persistent. I think it's good to be proactive in that sense and be guided by a physician or clinician who really has a good know-how of what's going on.
So for things like nerve injuries or sports related or overuse injuries, how would you say those are commonly treated?
So it kind of depends. So we can kind of go through some of the things that we commonly see. So to start in the hand and wrist region, common nerve related things are something like a carpal tunnel syndrome, which is a very common thing. People talk about that a lot. It's gotten a lot of kind of overview over the past few years. So pretty much basically just to sum it up, it's a compression of a nerve through your wrist and the median nerve in particular, and it provides sensation and function to the fingers there on this side of the hand, the thumb, index, middle, and the ring finger. So typically people will go to their doctor with the nerve-related symptoms, numbness, tingling, pain, can result in some stiffness and things like that. So typically the people will go see a primary care physician or orthopedist. Sometimes there'll be diagnostic testing done or testing inside the clinic. And in a non-surgical aspect, and if Dr. Save wants to get into it, he can go into the rest, but as a non-surgical, it's a lot about relieving the tension and compression on the nerve. Typically when our wrists are flexed for a long period of time, and even in the larger part, the greater extension part can also do the same thing. So it's a lot about making sure that they are in this neutral wrist pattern. We usually provide a prefabricated splint or sometimes a custom-made splint out of a thermoplastic material, like a moldable plastic. Typically, depending on the symptoms, we have them start wearing it at night, but there are different variations, and then goes into a larger aspect of education on typical times when people might have their wrists in a flexed position. So typing, depending on your seat height, you could be too low. If you're too low, you have to raise your wrists up. Sometimes people, they have to plan through their wrists to do certain activities or certain job related things. People who maybe have jobs in which they take vibration through the hand, things like that, tool related use. They're all things that we can kind of game plan on. How can you relieve some of the compression that you're seeing? How can you function more properly so you're not kind of making these things worse? So those are typically, for as an example, of one very common nerve related condition that we see frequently.
So Daniel, thank you for that. And how would you say, you say splinting and bracing for things like that, but how would you and Dr. Save work together as both a occupational therapist and an orthopedic surgeon, knowing when to refer for surgery?
Yeah, one of the great things about the HSS hand service and the hand therapist is that we work very closely together. We all attend conferences together every week where we discuss some cases, we review journal articles, and we're in pretty much constant communication about patients that we may send to therapy or they send to me for further evaluation. And it's really sort of giving me updates about how things are progressing, if patients are doing well, if they're hitting any roadblocks, should we change what we're doing, should we try different strategies? So we all have a really great working relationship, and I think that really benefits the patients that come here.
Yeah.
And, I don't know if you want to, include your perspective on that.
Yeah, no, of course. I think I could speak from personal experience that all of our physicians, but me personally working with our hand and upper extremity surgeons like Dr. Save, the communication and collaboration is unlike anywhere else I've ever been. The communication is constant. It is always in the best interest of the patient. There's a lot of back and forth as to, okay, this is what we're doing. It's working great. Okay, this may not be giving the results we want. How can we come up with a solution to better service this patient? And to speak onto that point, the patient is a part of that process. That's the good kind of care that we provide. They are a part of it. It's not just me and Dr. Save talking and telling you exactly what we need you to do. I mean, that's part of it, but it's, fitting it directly to the patient. And I think that we as a team, hands and our, upper extremity in general, there's a really good aspect of doing that. And there is that, if I think that there is something that needs a little bit further kind of, eyesight over one of our surgeons, it's very easy for me to say, hey, Dr. Save, I think that someone needs a little bit more, maybe needs another follow-up, maybe needs a little bit more care. And he is very receptive in making that and facilitating that.
Great. And then what are some ways that you can reduce risk of injury to the hand?
Yeah, I mean, we sort of talked about some of the injuries that we see. So, falls are sort of one of the most common things that we see. So, having precautions against falling is sort of an important way that you could try to reduce the risk of injury to the hand. Even taking proper care while handling sharp objects or, things like knives. We're getting close to Halloween. And so during this time, we oftentimes see injuries related to pumpkin carving, injuries to the hand while cutting an avocado is also very common. I don't know if you see that, Daniel. I think, we actually have some videos on the HSS YouTube page that show you the proper technique for doing both of those. So that might be something for some of our participants to check out sometime.
Oh, that's really good to know.
Yeah, I think to touch point on that is that we do the education department does a great job of generating these great resources. You started speaking on the falls and the precautions and how you could create a safer environment. I was lucky enough to be a part of an education thing that is on our HSS website that talks about fall risks and how you could shore up, your home and your bathroom where common falls take place. Not to get too in depth into it, but there are some, clearing your pathway, making sure that you don't have clutter all over the floor. Sometimes these rugs and floor mats can stick up and roll up. You can catch your foot on it. That's a very common one that I see. A lot of it outside the home, especially in the winter time. Just be very mindful. Take your time. A lot of it is mostly just like knowing where you are, knowing the situation. We're constantly in this go, go, go. So we're sprinting down the stairs, we're running to our car, we hit some ice, or we just trip over a crack in the sidewalk. So I think just being aware. I also typically don't be afraid. I don't want you to be walking around in constant fear, but just be aware. Take those steps on an icy cold morning. Take an extra moment to make sure that your pathway is clear in your bathroom. Make sure your floor is wiped down from any sort of spills and things like that. But if anyone is interested, there is the article there, and there's so many other resources, like Dr. Save said, on fall risk, proper hand, kind of things like the cutting, which is, we do see avocado hand, which is a very funny thing. It is actually a thing. So be careful whenever you're cutting. Never hold something and cut. I can't tell you how many times I yell at people that I see, family members and such, saying, don't cut like that. Don't cut like that. You'll be seeing Dr. Save pretty soon after.
All right, so now we're going to move on to more specific conditions. We do have a few questions on arthritis, hand arthritis, and inflammation. So hopefully we can address some of those. So first and foremost, what is arthritis and how does it commonly affect the hand?
Yeah, so arthritis is a problem affecting the joints. So healthy joints have a smooth covering on the end of the bone, which is called articular cartilage. And you need that in order to have a smooth gliding surface for the bones to move. So arthritis affects this cartilage. There's really sort of two major types of arthritis, the most common form being osteoarthritis, which is more a wear and tear of the joint. The second type of arthritis is rheumatoid arthritis, and I see that much less frequently, and that is more of an inflammatory condition which affects the joints. I do see a lot of arthritis affecting the hands in my office, osteoarthritis being the most common form of arthritis again. In the hand, I see it most frequently in the thumb area, the base of the thumb. Danielle, I don't know how much arthritis you're seeing in therapy, or where you see it most frequently.
Yeah, I think kind of like you touched base on, you guys typically will see them and do the diagnostic and help them with some of the education. Typically when we do see them non-surgical, it's typically a lot about the education aspect of it. We call it our joint protection program. It's a program that we provide for a lot of our arthritis, both osteo and rheumatoid, although like you said, osteoarthritis is much more common, especially in the thumb. And as far as a therapeutic aspect to it, a lot of it, it breaks down into a few different categories. There's the splinting aspect of it. So typically someone will come in with pain at the base of their joint here, like Dr. Save had already commented on, seeing it mostly in the thumb. It is also common in the tips of the fingers there, but especially for the thumb, typically we will offer patients a splint or a brace. These are called thumb spikas is the name of the brace or splints, providing some sort of relief and support to the joints. So that is one aspect. And then it's a lot of education about how can I effectively use my hands without causing undue and excessive stress to these joints. Because it's a busy life, we have a lot of stuff we have to do, and we want to make sure that you guys are continuing to do those things. But there are different adaptive strategies, compensatory kind of techniques, and even in some of the more progressed arthritic patients, adaptive equipment that can assist in your daily life. So a lot of times a patient will come in, maybe 1 or 2 visits, one for maybe splinting, maybe an additional one about the adaptive equipment, adaptive aspect of this. And then again, of course, always promoting, maintenance of good pain-free motion, I think is also an important thing. But there is definitely a large educational aspect to managing arthritis.
Yeah, that's absolutely right. There are many sort of non-surgical treatment options for arthritis. And I would say the majority of patients that come to see me in the office, at least initially, start off with some of these non-surgical treatments, whether it's the joint protection program, whether it's splinting, just sort of learning how to do things a little bit differently. Danielle, I think one of the most common things that I hear is people have a hard time opening jars. I don't know if you hear that, but that's sort of one of the most common complaints, especially with thumb arthritis. So just learning how to, do it a little bit differently, using an assistive tool to do it is very helpful for patients.
Yeah, absolutely. I think that's a very, very common one, like you said, and it's mostly just due to the amount of force, the position you have to put your thumb in. And yeah, there are strategies. So I think, getting the proper diagnosis is key first from the physician who is familiar, and then getting you, either if it's appropriate in front of a therapist or if you can with your physician, but getting someone who can help you, guide you through these things, help give suggestions. But yeah, typically, the osteoarthritis and things like that. Yeah, it's an education you're here for a few visits, and then it's something that they have to integrate into their life. But there's always that support here from us if there's questions or they need to return visits to strategize or come up with a better plan. So I think there is that flexibility as well.
Thank you for touching on a lot of that non-surgical treatment. Is surgery recommended ever for hand arthritis, Dr. Save?
Yeah, absolutely. There are surgeries for hand arthritis. It really depends on how a patient is doing, how much the arthritis is affecting them and affecting their quality of life. So we really evaluate each patient individually and make sure that their treatment is tailored specifically to them. In general, surgeries in the hand sort of fall into two categories. One category is surgeries that preserve motion to the joint. So whether that's by replacing a joint or removing certain bones and reconstructing a joint, but that preserves the motion in the hand. And then the second type of surgery is a surgery that takes away motion. So it's called a fusion, where bones are fused together, where you lose motion, but it takes away all of the pain. And in most cases, because we have so many different joints in the hand, other joints can sort of compensate for that function. So to answer your question, yes, certainly we do have surgeries for arthritis of the hand, but it just comes down to each individual patient to sort of see which surgery would be best for them.
Great. And can you just briefly describe some signs and symptoms of hand arthritis?
Yes. So the most sort of common and earliest sign is some pain affecting the joints. So it can start off as somewhat of a dull ache. Patients also have some stiffness in the joints, and over time they may notice that it's more difficult to do some of the activities that they are used to doing. Like we talked about, opening a jar can become difficult. Turning, the car key can be difficult. Lifting heavy objects can become more difficult. And over time, as things progress, the pain can get worse. The stiffness, meaning difficulty moving the fingers or the joints, can be more difficult. The joint can become more swollen. And then in the most advanced forms, they can be sort of wearing away of the bone. And so patients may notice that the finger or the hand looks different, the joint looks different. Maybe there's a little bit of a deformity from the arthritis. So that's sort of the spectrum of symptoms that you see with this.
We had a question if someone can explain why recovery from a fracture on a wrist increases osteoarthritis on both hands.
I don't know that I would definitely agree that having a trauma like a fracture is really the biggest risk factor for getting arthritis. So yeah, that includes things like fractures, dislocations, any specific injuries that affect the joint surface themselves. All of those things are risk factors to get what we call sort of post-traumatic arthritis, meaning after trauma. And even if these injuries are treated properly, they can sometimes still get arthritis. So certainly having trauma to a certain joint does increase the risk. I wouldn't sort of necessarily say that it would affect the opposite limb. It can, because sometimes patients may sort of, because of an injury to one side, they may use the other side more or expect more things from that other side and just have more load or more demands from that side, and maybe that might accelerate some arthritis, but I wouldn't sort of expect it to directly cause arthritis on the other side.
Great, thanks. So next up is going to be trigger finger. I know there's a lot of interest in that. So can you describe what trigger finger is and how does it commonly affect the hand?
Yeah, sure, I can jump in on that. Dr. Save, I can give him a break from speaking a lot about the post-surgical subfibular arthritis. So pretty much it is a narrowing of the space. So you have flexor tendons on the front here. Their job is to pull the finger down when you make a fist. The tendon runs alongside each individual finger. Surrounding them is a sheath that covers them and provides a channel for them to go through. So really a narrowing of space of that channel, either from inflammation of that sheath itself or the tendon. And what can start to happen, patients will start to get pain and swelling of that area. As the swelling increases on that tendon and surround that area, that tendon can get caught alongside a band that crosses the fingers. Most commonly, it is here over a band called the A1 pulley. This band, its job is to keep the tendon remaining flat on the bone. So as that tendon glides through, if it's swollen, it gets caught on that band. further causing irritation. If it continues to progress, that inflammation gets worse, it can get stuck or click or pop, or that's why, trigger. So some people with some of these chronic things, they can, if it develops chronically, they'll get that clicking, they'll get that snapping, they'll get that it's stuck, and they might have to passively move that finger out. So it is very common, and that is typically the presentation and how it manifests. I don't know if you want to add anything, Dr. Save.
Yeah, no, I agree. Pain, stiffness, triggering meaning just that the finger gets sort of stuck as you try to move, and then, yeah, in severe cases, the finger is sort of stuck down here and you have to use your other hand to straighten it out.
So what would be some risk factors for trigger finger, and is it preventable?
Yeah, there are some risk factors. Sort of the most common things are conditions like diabetes, even rheumatoid arthritis. So I see trigger fingers more commonly in patients who have those conditions. And they're also more likely to have more than one finger affected. Certain sort of forceful activities involving the fingers or overuse type injuries can also cause this problem. But I see plenty of patients who, really don't have any risk factors, or they can't really recall that they did anything, and just started having this issue.
Yeah, I think that's a really good point. I think that's key. Like, there are these risk factors, and of course there are things that we see, the prevalence is increasing, but like Dr. Save said, there are people who come in and say, I don't have a manual job, I don't use my hand a lot, it's my non-dominant hand, I don't have any of these risk factors, I don't quite understand why it's happening. And sometimes it's just kind of, that's the way it manifests, and those are the symptoms. So I think that was very well put. Yeah.
So Daniel, what would be some treatments non-surgically for trigger finger?
Yeah, so non-surgically, typically, sometimes they will get an injection from the doctors, one non-surgical, whether they feel that is appropriate. Dr. Save can speak on that. As far as from a therapeutic standpoint, it's really about reducing the inflammation and reducing the frequency of those snapping, because every time you're getting those clicks, you're theoretically causing more irritation, and then theoretically causing more inflammation, furthering the problem. So things that we will do, again, we will do splinting to immobilize the finger in certain ways. Sometimes it's a full finger splint. Sometimes it only needs to be partial of the finger, depending on which pulley it's getting stuck at and kind of how the symptoms are manifesting. And then it's mostly about trying to keep the uninvolved joints loose, preventing these clicks, limiting the amount of hard grasping you're doing, because that can cause irritation as you use and kind of overstress that tendon the same. But outside of that, those are the most effective ways. So typically, again, depending, we'll get a patient in, maybe post-injection, maybe prior to injection. We'll split them. Usually we'll tell them, wear it at night. A lot of times, because when we sleep, we tend to sleep with our fists very clenched. And again, that could just cause overstress and kind of facilitate this problem a little bit. If it's more progressed, we might need to have them wear it more frequently, maybe even throughout the day or during activities that require them to use their hand a lot. And then as far as the timeline, it really depends on the symptoms. Sometimes we'll have wear them for 3 weeks, sometimes we'll have them for 6 weeks. But it really kind of depends. But that's the immobilization aspect, to let that tendon decrease in its inflammation, decrease that nodule, that swelling that's causing the problem in the first place.
Yeah, I find the splinting really does help, especially at nighttime, especially in patients who wake up in the morning and their finger tends to be stuck down. Typically the symptoms are usually worst in the morning. And so having the splint to wear at nighttime that keeps it straight really does help a lot of patients.
So is surgery recommended for trigger finger? Let's say they're having some difficulty with the non-surgical treatment options.
Yeah, like Daniel said, there's many non-surgical treatment options. Injections in particular, I find to be very helpful and curative in really the majority of cases. And so again, most patients that see me can be treated without surgery. But yes, so if those non-surgical options are not successful, then there is a surgery for this.
Great, thank you. And while it's not the hand specifically, we'd like to spend some time today discussing wrist conditions. So can you briefly describe the anatomy of the wrist?
Yeah, so the wrist, similarly to the hand, like I said, it's all sort of connected together. So the hand and then the wrist is right over here. There's 8 sort of bones, carpal bones, that make up the wrist, and then articulate with the radius and ulna, those 2 bones that we talked about in the forearm. The wrist is a very complex, similarly to the hand structure. So, you can do many things with your wrist. So whether it's moving it up and down, moving it, side to side, going palm up, palm down, all of those things are sort of because of the structures, in your wrist area as well as your forearm.
What area some conditions commonly seen in the wrist that can impact a person's ability to do what they need to do and love to do? Carpal tunnel or Quervain syndrome.
Yeah, I think the carpal tunnel syndrome is a very common one. Quervain's is another common one that we will see, a repetitive kind of stress, inflammation, and irritation of the tendon in the sheath on the side of the wrist and thumb here. That's Quervain's there. We'll see again the distal radial fractures is very common. On the other side of the wrist, on this ulnar side, on the side opposite, there are things, often structures called the TFCC is a thing that we see common. It's a cartilaginous structure that supports that side of the wrist. Commonly those things can be overstressed, overworked, and patients can sort of get some pain there. I would say those are the big ones that are popping out on my head right now, that we see. I don't know if you have any others that you wanted to add, Dr. Sarve.
Yeah, no, I think that sounds right. Similarly, the same things that can affect the hand. So things like we talked about trauma, falls, fractures, dislocations, all of those can affect the wrist. Similarly, you can have nerve conditions like what Daniel said, carpal tunnel being the most common one. Tendinitis, again, something called Quervain tenosynovitis, which causes pain on this side of your wrist is very common. That sometimes is even called mommy's wrist because we see it very frequently in new mothers who are sort of doing this motion, picking up their babies. So yeah.
So if someone has experienced wrist pain that they think might be the result of one of these conditions, when should they seek the care of a clinician?
Yeah, I think it really depends, how long things have been going on or, how severe the symptoms are, and how much is affecting their day-to-day activities.
Yeah, I think like Dr. Savi had put, it is very patient dependent. Obviously, if there's any sort of trauma involved with it, that's an obvious one to see. But I think, kind of like we said before, I mean, there are various steps you can take if something is persistent and consistent and all those kind of things. I think it's good to see if just kind of the normal, like, we call like the RICE method, like rest and ice and things like that for non-trauma related things, I think are, if you're doing that for a bit and it's not making any improvement or there's unusual symptoms or it's directly impacting your function. But if those things are occurring, I think it's a good opportunity to seek some attention.
And are these conditions preventable, and how can people keep their wrists healthy?
Yeah, some of them are preventable, some are not preventable. Again, sometimes accidents happen, falls happen, injuries can happen. So sort of some of the similar principles to what we talked about in terms of the hand and sort of avoiding, symptoms or problems within the hand also apply to the wrist level.
Yeah, I think we talk with certain patients who come in with various things. How do I prevent it from getting worse? How do I prevent this from occurring again? A lot of it, like Dr. Save touched on, I mean, and also, proper positioning, proper lifting mechanics, proper ergonomics can contribute to some of these things.
Yeah, I think ergonomics is definitely a big one. And I believe, Daniel, you do sort of an ergonomic assessment
Yeah.
through the therapy through therapy. I found that that's been very helpful. Especially now that a lot of people are working from home and maybe they don't have the same setup that they had at work, but they're doing a lot of typing, a lot of Zoom calls, that kind of thing. Certainly doing an ergonomic evaluation can be helpful.
So what kind of hand conditions or wrist conditions can someone see from working from home, like overuse injuries, typing on a keyboard?
Yeah, really overuse type things is the most common, sort of affecting, it can affect the fingers, the wrist, even the elbow we see frequently. A pinched nerve down by the elbow that can again give you symptoms in your hands.
Yeah, I think we've seen a shift this past 18 plus months since people have been working from home. I mean, we still get the normal stuff that we typically see, but we've been the doctors and therapists have been seeing this a little bit of shift of these kind of, patients who are having these repetitive stress type things, irritation of tendons in the elbow coming up through here just from over typing and usage of the fingers. This constant repetitive kind of motion from typing can cause irritation of those when it's done improperly or done over excessively. So I think it's been an interesting shift, but definitely one, like Dr. Save said, that we're seeing and handling.
Great. So what should a person look for in a clinician? For example, if they're having a wrist or hand injury, do you see a hand surgeon specifically? Should you look for a PT, an OT, a CHT? How can we guide these patients?
So from a therapeutic standpoint, a CHT like myself and all of us down at the hand center, we just have that extra specialization similar to Dr. Save. A general physician treats things generally, and then they go and do a specialization. It's similar for therapy in this CHT certified hand therapist world. So I think definitely things that require a little bit more knowledge, a little bit more experience, especially, certain post-surgical things, or if you're not seeing the results that you need from a clinician that you may be familiar with, or one that's in your community if you don't have access to a CHT. I wouldn't say that for everything you have to see a CHT. I don't think that's necessarily the case. I think, there are many things that can be treated otherwise, but definitely when you need something that's a little more intricate and maybe a little bit more needs that little bit of know-how. As far as PTOT in the CHT world, so when to see one versus the other, here at our center, in the hand and upper extremity rehab center, we have PT-CHTs, we have OT-CHTs. I think, by definition, the occupational therapists have a background in functional integration of that into the rehab aspect, but the PTs do now as well. I think there used to be a greater separation in the CHT world in particular, but I think all our therapists are well versed. So sometimes there are insurance restrictions. Sometimes maybe there's a better fit as far as, personality or schedule and things like that, PT versus OT in the hand world. When you get out of the hand world, it becomes a much different conversation when the CHT isn't involved. PT may work more on lower extremity and your gait, balance, walking, things like that. OT may work more on functional use of the upper extremity and hand, but can also work more generally as well. So there is a little bit of that kind of understanding when to see what appropriate from a therapeutic standpoint.
Yeah, I'd agree with that. In general, I'd say many of the patients that I see start off with their primary care doctor. That's sort of the first person that they see for a problem. Sometimes in the case of trauma, where they had a fall or they had a fracture, they may have ended up in an emergency room or an urgent care center, and they had X-rays that showed there was a fracture, and then they're referred to me for further management. We also have a great sort of non-operative team at HSS, and that includes primary care sports medicine physicians, physiatrists, which are non-operative musculoskeletal doctors, and many times patients start with them and sort of are evaluated, whether it's things like X-rays or MRIs, nerve conduction studies. And many times they sort of start off with some of the non-operative treatments with them. And then eventually when things are not getting better, or if they've sort of exhausted some of these non-surgical things, then they get referred to a hand and upper extremity surgeon.
Thank you. So before we talked about, kind of the times we were in and working remotely, this might be directed more towards Daniel, but can hand therapy be done through telehealth?
Yes, that's a big shift that we've seen over this past 18 plus months, is beefing up our telehealth program and our access for our patients who either are unable to leave the home, work from home, all these kind of things. To touch base on that, I do know that the doctors as well have a telehealth service that they is very, very robust, and they do follow-ups. They'll do all these kind of things, telehealth. So it is also another great option, but absolutely. There's many different reasons why we may or may not do a telehealth, but it could be a very enriching and successful experience, especially to see someone in their own environment can be very helpful, especially, Dr. Save touched on the ergonomic aspect, seeing your home, seeing your setup, can be very helpful. So absolutely.
Yeah, from my side of things, we've certainly been doing more telehealth than we were before. Certainly before COVID, I don't think we were doing any telehealth. But there's certainly a role for telehealth. There's limitations with telehealth as well. If we need, for example, in the case of fractures, you need to get X-rays. Can't do that from home. Also the physical examination is limited. Certainly I can have you do certain things, certain maneuvers, but there's sometimes no substitute for directly in person examining your hand or wrist.
Agreed.
So sorry, do you have something to add?
No, I just agree with everything that Dr. Save had said. There is that physical component that is helpful, but there are definitely circumstances where it could be very appropriate.
Great. So Daniel and Dr. Save, we have a ton of questions coming in, and I just want to let the audience know that we're going to try our best to get to all of them. So I'm going to go through some of them now. Some questions about self-management techniques. So what can you do for inflammation in the hand? Are there exercises to do for an arthritic hand?
So, arthritis can be challenging depending on where you are in the process, what phase you're in, but generally speaking, yes, there are things that you can do to help manage some of these symptoms. You spoke on swelling and things like that. There are various types of techniques that can mobilize some of the fluid around. There are things that we as therapists can provide for our patients, such as gloves and other type of compression when appropriate to the hand, wrist, upper extremity. As far as exercises, what I preach to my patients a lot, which I touched on previously, It's about maintaining and facilitating healthy motion in a relatively pain-free environment. We don't want to push through that pain. We don't want to cause another inflammatory response that can aggravate arthritis even more. So, as far as the fingers are concerned, there are definitely things that we can do to help relieve some of the symptoms of stiffness. A lot of my patients say morning stiffness is one that we commonly see. So, how do they tolerate different modalities such as heat, and at times more so for the osteoarthritis versus the rheumatoid arthritis. For heat, it can help kind of facilitate movement. So typically what I will say the patient after an evaluation is, okay, let's heat up the hand, go through some of these exercises. Usually they feel the stiffness has reduced, and I commonly say to do that in the morning. There's something called tendon gliding exercises, which I commonly give to patients to help facilitate some finger motion. But again, I think it's important to make sure that these are the appropriate things for your case specifically. But generally speaking, for most people, these are safe to do with a diagnosed arthritic condition.
Can you show some examples of exercising the fingers? And thank you for addressing the hot versus cold question. I think you mentioned heat. Should you ever use cold compresses?
Yeah, so it varies dependent on the patient. So this whole heat versus ice thing, they can facilitate or help in certain ways. It's not going to change the underlying condition. I think that's important for people to understand. These are used to help facilitate. So it's very much on a person by person basis. Some people tolerate one better than other. For a diagnosed osteoarthritis that isn't inflamed, I typically do prefer the warmth. It can help reduce some of the stiffness, but you have to see how your body reacts to it. You have to speak with your physician, speak with your therapist who knows your hand to say, is this appropriate for you? Ice. There are times that I will use ice. I'll be honest with you, I use it less and less as the years go on. I think typically, generally speaking, when I sometimes recommend ice or a cold compress or something, is if there is newly acquired pain and inflammation and you need symptom relief in certain things like a tendinitis or things like that, you can provide a cold compress to help bring down newly acquired. A lot of these chronic things, these pain that are consistent and everyday and don't tend to fluctuate, the ice isn't as helpful because ice is used to slow down those processes that cause inflammation and pain. And in a chronic patient where the pain doesn't fluctuate, those processes aren't really occurring at the same rate, aren't really occurring in the same way. So it is personalized. I hope that was helpful. But there are uses, again, not alone, in conjunction with other exercises and things like that.
Do you see any correlations between a change in diet, i.e. going gluten-free, and improved condition, arthritis, and pain?
I'll let Dr. Sabe take that one.
Yeah, we do sometimes see that. And it again depends from patient to patient. I think Daniel had said, you kind of know your body the best. And so we have certainly seen that in certain patients, especially those that have certain inflammatory conditions. Those kinds of modifications can certainly make a difference.
Thank you. There's somebody who has read that soaking the hand in warm salted water eases osteoarthritis. Can you speak on that?
Yeah, so again, the warmth is a modality similar to any other type of heat application. I'm not aware of any research that shows that specifically warm water with a increased salt content or some of these other things can help change that. But I mean, there is some information out there that may say this, and I think the big thing is see how your body responds to it. The heat again can be beneficial. Is it more beneficial than any other type of modalities? Nothing that I've seen substantially. It's more on a person by person basis and how they react to it.
Yeah, I'd agree with that. There's certainly an underlying structural problem, like what we talked about, meaning aware of the articular cartilage. So, all of these strategies are meant to help with symptoms. They don't necessarily reverse the changes that have already happened in the joint. But certainly, they can help with the symptoms and the pain and the stiffness and that those kinds of symptoms.
And then when I do exercises, my arthritic exercises for my CPC and wrist, on the other hand, it seems to aggravate my tennis elbow. Should I continue to do these exercises and just ice afterwards?
So I think if you were given these by a therapist or a physician, I think it's time to go back and see if there's a different way in order to perform these, or maybe you are performing them improperly. When I have an arthritic patient or someone who has an inflammatory type condition, I generally want everything to be pain-free. I don't want one problem to cause another problem, speaking personally. So I think it's time for you to, maybe go back and see if there's a better way to do this, because really exercise, I think a big misconception is that pain is a part of rehab, and pain has to be there in order to get a successful result. And unfortunately, in certain things, sometimes we cannot avoid some level of discomfort in certain cases, but it is never the goal and should never be a consistent part of an exercise program. So I think generally speaking, I would say no.
So we have some questions on overuse injuries. What about injuries from manual wheelchair overuse of hands? What can be done to prevent or treat?
Daniel, you might be able to address this better than I can, but certainly there are sort of some modifications that can be made, sometimes even, transitioning to a different type of wheelchair or something motorized. Sometimes splints I've found have been helpful.
Yeah, I'm sorry. Can you repeat the question? Sorry.
Is that this? No, that's okay. What about injuries from manual wheelchair overuse of the hands? What can be done to prevent or treat this?
Okay, gotcha. Yeah, just to continue on pretty much what Dr. Save said, I think there are ways to help manage these symptoms and help to alleviate them. First, make sure that the wheelchair that you have is fit for you and is proper. Certain, depending on the width and height of certain things, can cause undue stress onto the wrists and hands and elbows and everything like that. There are also lower resistant wheelchairs. There are kind of self-propelled. There's like an assist when you move the wheelchair, kind of like those e-bikes we see running around Manhattan now. They give a little bit of a boost, not as fast, you don't have to worry. But yeah, there's a lot of options out there. And again, it may be appropriate for you to get a motorized system as well. I think it just depends, but there are things as well as, like Dr. Save says, splints and things like that that can position your hand or wrist in just a more functional way to help. So there are things to do that can help.
Great. And what would be your advice to a younger person who is starting to feel pain, stress in the thumb from overuse, mostly from scrolling and typing?
I knew that was coming. Yeah, text less. Yeah, no, I think we're seeing a lot of this scroll, thumb pain from overuse of devices and things like that. I think we can get caught with our head down and our heads in our phones. So the unfortunate truth is that when there's a direct cause like something like that, the major thing to do is to reduce the activity. Voice to text. If you're only scrolling with your thumb, utilize other parts and use the other hand. Even if you can distribute some of that repetitive stress to other structures of the body, it can help. But yeah, that's a big problem that we've been seeing more so than 10 years ago.
Yeah, I think I've seen a lot of people benefit with some of these dictation softwares, where you're having to type less, use the phone less. that can certainly be beneficial.
Is there any equipment out there like ergonomic equipment that can help with some of the scrolling and maybe preventing wrist overuse injuries, wrist or hand?
So as far as when we're talking about computer use, which is a common one, there are things, there's things called vertical or upright mouse. So instead of the mouse being flat down, it is tilted you in a more neutral location, which can help unload structures that are being overstressed. There are ergonomically based keyboards that have a relative curvature to them, or split keyboards that actually separate, and you can position them in the position that works best for you. There are soft touch keyboards. Instead of having to hit the key very hard, they're much lighter, they're softer, requiring you to have to type less. Like Dr. Save had said, there's voice to text, which has been something that I've recommended. There's even one that we have at the clinic down in Manhattan, that we can show some people, these vertical mouses, but there is a bar with a rolling bar that instead of having to scroll with your finger, you can actually scroll with your whole hand. The bar is underneath and you scroll. I mean, there's a lot of different things out there. So it just depends on what works best for you and kind of your workflow and your particular injury. But there are millions of things out there, some helpful, some not.
Can panelists discuss deformities due to arthritis and if anything could be done to correct these?
Yeah, so certainly in more advanced forms of arthritis, you can get deformities. We sort of touched on that briefly. There are certain scenarios where splinting can help with some of that, but many times when you're looking at a bony deformity, we are sort of talking more about a surgical solution for that, rather than something non-operative.
Thank you again for tuning in. And if you have any questions or would like to learn more about HSS, feel free to comment below or visit hss.edu.